Thank you all very much for joining us on Facebook Live and on Zoom. I'm going to introduce our panelists in a moment. My name is Andrew Romanoff. I was the Speaker of the House and the President of Mental Health Colorado. I'm a candidate now for the United States Senate. We're going to be holding virtual town hall meetings every Friday at noon Mountain Time for the foreseeable future. If you're joining us, you probably got the details, but if you want to share them, you can find me at andrewromanoff.com. I want to say first, I hope you and your family are safe and healthy. We're using these opportunities to provide information and to engage folks in this conversation. We used to hold town hall meetings in person and at coffee shops and brew pubs and backyards and living rooms throughout the state for the last 14 months. We obviously can't do that at the moment, but we hope this will be a useful experience for all of you. We had about 1,000 folks join our conversation last week on mental health, how not to panic during a pandemic. And I know we've got more than 1,000 folks who are signed on to our conversation today. In the weeks ahead, we'll be talking about other aspects of this crisis. What can we take from this experience to improve the healthcare and health insurance systems in America? What are the consequences and the policy implications that this pandemic holds for Colorado and for the rest of the country? Today, though, we're lucky to be joined by a panel of infectious disease specialists. If you are joining us on video, you can see their names on the screen. Dr. Charlotte Ellenbogen is with Western Infectious Disease Consultants and works at a variety of hospitals in Metro Denver and Northern Colorado, as does Dr. Teresa Cushman. To her right, Dr. Catherine Springer is with Colorado Infectious Disease Associates and is also Director of Travel Medicine and Infection Control at Porter Adventist Hospital. So I want to thank Drs. Ellenbogen and Cushman and Springer for joining us. And I'm inviting all of you who are listening or watching to submit your questions through Zoom or Facebook in the chat features. If you're listening in by phone, unfortunately, we're not going to be able to take call-ins because we're expecting more than 1,000 folks in this teleconference. That would be a little unwieldy. I'm also going to acknowledge a couple things at the outset. We're not going to be able to answer every question today. We're not going to have time to pose every question, and we may not have answers to every question. And our focus today is not on a public policy. I've asked these doctors to join us for a conversation about what we know around the disease and how to protect ourselves. I will tell you that we are organizing policy conversations in the weeks ahead with a variety of experts from public health and other fields. So if we don't get to your question today, or if you've asked a question that doesn't fit squarely within the scope of this teleconference, I'll acknowledge that at the outset. But I want to start by asking our panelists to tell us a little bit about what it is like to be an infectious disease doctor during this crisis. It's an unprecedented experience for all of us, obviously, as Americans, but also presumably for you as specialists in this field. Dr. Springer, would you like to share some thoughts about that?
Oh, sure, I will. As an infectious disease specialist, I'll say my practice has changed drastically. I think most people think of infectious disease specialists as doctors of contagious disease, but actually most infections are not contagious from person to person. Infectious diseases are those caused by microbes. And so we don't deal with diseases that are this contagious on an average basis where we and our colleagues are at risk, and that definitely increases anxiety. We have a lot more patients than we normally see because the COVID-19 patients add to the patients that we have already been seeing all this time, the types of patients that we're more accustomed to seeing. So we're much busier. There's a lot of things that have changed. I'll let the other doctors talk a little more about it.
Dr. Ellenbogen?
Hi, this is Hi, this is Dr. Ellenbogen. Thank you for asking that question, and thank you for asking us to be on this panel. You know, I think I speak for all of us when I say that we were drawn to infectious disease because it's a fascinating specialty, medical specialty. We get to see some very interesting cases on a daily, but this is really unprecedented for us. And so, you know, I concur with sort of Dr. Springer in that our practice has changed quite considerably. You know, the anxiety over this in our patient population has significantly increased. We have changed our a method of seeing patients because of this. We do telehealth regularly with some of our patients who live in areas that are not close to our clinics. But now we've implemented more telehealth visits with our patients, more than we would ordinarily have done. And that's an interesting dimension, larger dimension to our practice. And also, one thing that Dr. Springer had mentioned in our discussions was that we really are not the frontline providers here. The frontline providers are the physicians who are in the emergency room, and the nurses and the hospitalists and intensivists who are on the floor. We are, our role in this really has primarily been in the role of consulting, offering advice, maybe helping with some of the protocols. And we do go in and see many of these patients, but frequently we are there to rule out if they have another infection, as well as COVID-19. And so it's really just been a remarkable effort on everybody's part. And it's really quite an experience to be a part of this on the clinical side.
I should say, even though you may not consider yourself on the front line, I do know you're taking time out of your busy schedules and your lives. And I want to say again, thanks for doing that. Dr. Cushman, anything to add? What's it like to be an infectious disease specialist in this era?
Absolutely. Thank you for having us. I concur with everything that my colleagues, Dr. Ellenbogen and Dr. Springer, have said. I think one other thing that has changed a lot for me is I went into medicine because I'm a people person. I love spending time with my patients, and that's one of the primary things that I wanted to do as a doctor. But a lot of people don't realize that some doctors, and especially infectious disease doctors, have other roles within the healthcare system. Some of us, Dr. Ellenbogen and myself and several of our other partners, and Dr. Springer as well, are all involved in what's called infection prevention. Hospital systems have policies and plans in place to help deal with not only day-to-day things in the hospital, but also, in terms of how do we make sure we're cleaning our equipment properly. But we're seeing a lot more work in the background as well, helping our hospitals and our hospital systems develop plans and policies for dealing with the pandemic. So I find that I'm spending a lot more time behind the scenes as well, doing extra work beyond my ordinary day-to-day work as well.
I appreciate that. We are being flooded with questions now, and I'm going to try to do justice to them. I will say, if you all want more information, those of you who are watching this broadcast, I encourage you to go to either the CDC website or the Colorado Department of Public Health and Environment website, both of which are up to date with the latest information that we have available. I recognize you all, as docs, are not going to have answers to every question that we're going to ask you, but I'll do my best to get through as many as we can. Should I be wearing a mask? I'm a member of the public, walking around to the extent I'm allowed under the stay-at-home orders. Should I be wearing a mask when I'm outside or in any other area outside my home? And feel free to jump in, whoever wants.
I can start off, I can jump in. So the answer to that is, if you are an otherwise healthy person and you have not been diagnosed with COVID-19 and you're not symptomatic, you should not be wearing a mask. The key to not getting COVID-19 is avoidance. And so wearing a mask does not do that for you. It may be helpful if you are in close contact with somebody who is a known COVID positive person and or is symptomatic. But in the general population, if you are healthy, if you're going to the grocery store, if you're going for a hike, if you're walking along the sidewalk, if you're in your communities, you do not need to wear a mask. The best way of avoiding this is you don't linger, you stay 6 feet away from somebody if you're in contact with them. But the key to this is avoiding close contact. Wearing the mask will not do that.
What if I'm taking care of somebody in my house who may or may not have the disease? I'm a caregiver. Should I be wearing a mask at home?
If you're caring for someone with COVID-19, it will benefit you to wear a mask, but it's probably more important that the patient themselves wears a mask. It's spread when the patient coughs or sneezes, and if you inhale droplets from a cough or a sneeze. So if they're wearing a mask and it can't get beyond that, that's going to protect you. There are definitely lots of guidelines out there for people who are caring for someone that has COVID-19, and those can be found on the CDC website as well as the Colorado Public Health website. And people who are caring for people with COVID-19 can protect themselves reasonably well from acquiring the disease. And we have many caretakers who have not caught the disease, so it can be done.
If I have COVID and I've recovered, am I now immune? Do we know the answer to that?
Unfortunately, Unfortunately, I don't think that we have enough information to say that at this point. It's, research is actively being done to look at this, but I don't know that we have enough information to say definitively if we do or not. We would hope so, but I don't know that we have enough information to say definitively.
Am I still contagious if I've recovered from COVID? Do we know the answer to that?
So that's another one of those questions that has we don't know. If you are, we know that people who are less symptomatic probably are less likely to spread the virus. If you've already been diagnosed with it, we know that the people who are repeat tested, the virus can still be detected in people several weeks after they became symptomatic. What we don't know is if we are still detecting the virus, if that still means that you are infectious. In other words, is the presence of the virus in this test reflective of a live virus? And we are not certain of that at this point. And the virus has been detected in people in some studies up to 37 days out from their first positive test. So that's an area that is a little unclear at this time. The likelihood is that you are not going to be very far out. We know that with other viruses that are very common, that people can still have positive tests even weeks to months from when they first became infected, but we know with those viruses that you are not infectious. With this virus, it's still unclear.
Certainly most contagious within the first few days of the virus.
Yeah.
And as the symptoms resolve, you're less contagious.
Correct.
What are the symptoms that we should be looking out for?
The classic symptoms that are described are a fever and a dry cough. There are other symptoms that I know have been discussed in the news media about is a lack of smell or taste. Is that possibly a symptom? There have been certainly other reports of various symptoms, but largely what we know is that the, I would say, quote unquote, classic symptoms are fever and a dry cough. Later in the illness, people then can progress to have breathing problems, such as feeling like you can't catch your breath or can't get enough air.
Can you, just to follow on that question, at what point should we try to get a test? If we try, can we get one? And does the result of that test change a course of action for us?
For most people, the result of the test won't change the action because most people who have COVID-19 will do well with this and write it out at home, even though it may last a couple of weeks. And there's no proven treatment for patients like that. We're using some experimental medications that are used for other diseases in very sick patients in the hospital, but for patients who can deal with this at home, those medications should not be used, and there's really no specific treatment. There are testing sites in the Denver area where people can get tested. Emergency departments are a bit overloaded right now. So they're pretty much just testing patients who are sick enough to come into the hospital because they just don't have the capacity to be testing the community right now. But National Jewish is offering some testing for the community. There are several clinics called Stride Clinic that are offering testing. And this changes on a daily basis. New clinics open up that are doing testing and other ones stop doing testing because they're overloaded or don't have the supplies. So hopefully people can search on the internet for a testing site if they feel they need to be tested. I do think it will help to be tested if you need to know something like when you can go back to work, because it's a little different with COVID-19 than if you have a normal cold. Or if you live in a home with immunosuppressed people or people with heart disease, people with lung disease, it may be good to know so that you can be extra cautious to stay away from them, or maybe even stay in a hotel while you're sick if that's possible. So there are certain people that may really need to know if they have it. But for most people, you can probably go by the symptoms and know that you have it and quarantine yourself.
How long would those symptoms persist before you'd say, gosh, I ought to get a test or take the steps that you just suggested?
I think the more important thing is if the symptoms are persisting to a point where you can't breathe, that you get medical care rather than getting a diagnosis. And so if you really have shortness of breath where you feel like you're not getting enough oxygen, that is a big clue to go to an emergency department, because then you're likely going to need medical help.
Dr. Springer touched on treatment, and this is a top of the list for a lot of folks there. So I realize we're having a conversation today about what we know, which is different from the conversation we'll have in a week or a month from now. But when it comes to treatment, any other thoughts? There are a lot of anecdotes and speculation circulating across the country. What do we know about the effectiveness of proposed treatments?
Unfortunately, we don't have any proven effective treatments against COVID-19. Typically what we do when testing certain types of treatments for disease is they go through a very rigorous process of testing, first in animals and then very stringent trials in human beings to make sure that they not only are effective, but also safe to use. And at this point, you're correct. We have anecdotes, we have reports of medications that have been tried in other countries that are experiencing a high volume of patients during the pandemic. But at this point, we don't have any proven treatments, and that includes supplements and vitamins, as well as other types of FDA-approved medications. The public will hear reports about medications that are being tried in the hospital. I know it's been heavily covered in the media that there are medications that in other circumstances would be used to treat other diseases, a medication that's used to possibly treat malaria or rheumatoid arthritis, certain other types of experimental medications being used as well. But it's important to also note that these medications are being reserved only for the most sick patients who are in the hospital. And that, again, we don't have hard and fast, good evidence to know that these treatments actually work. Outside of, yeah, go ahead, Charlotte.
No, sorry, Teresa, go ahead.
Yeah, I'd say outside of this emergency pandemic situation, we wouldn't normally be trying things, but this is an unprecedented situation.
And if I may add to that point, so as well as treatment, I think some of these medications have been touted as perhaps they're helpful for what we call pre-exposure or post-exposure prophylaxis. And what that means is if I take these medicines now, will this prevent me if I get exposed from acquiring the virus? And conversely, if I know that I've been exposed and I start taking these medications, will that prevent me from getting the virus? And there is no good data to support that either. And so there are, stories of people who are taking these medications as a prevention. There is no merit to that at this time. And particularly in light of the fact that we are reserving these for our sickest patients, they really should not be being taken. And the other piece to it is that these medications are not benign. So they are not without their own side effects. There are many interactions that these medications may have with other medications that people may be on for liver, or if they have liver disease or heart disease or kidney disease or issues with their blood pressure. And so we have to be very, very careful in choosing who the right people are for these and making sure that we're not creating more harm to them because of their other underlying illnesses in trying to figure out if these work. And so it's just very important that we do this the right way and not create any more harm to patients.
I want to be clear because it sounds like it may not go without saying, in the absence of the evidence that we're still trying to gather, folks should not be self-medicating or experimenting or conducting their own quasi-clinical trials at home with a...
Correct.
Yeah, that's exactly right.
Absolutely.
I assume the answer to this question is we don't know yet, but a lot of folks are asking, when is an effective vaccine likely to become available? What's your best guess?
This isn't really a guess. I mean, I think, and if you listen to Dr. Anthony Fauci, who's very highly regarded in the infectious disease and medical field in general, it was saying, 12 to 18 months, which is usual for vaccines. And we sort of take our cues from Dr. Fauci and the CDC and the NIH. And to me, that seems like a reasonable timeline would be within 12 to 18 months, but probably not sooner, given the tests that have to be performed.
Someone's asking if they should be concerned if they have a sore throat.
Well, sore throat is sometimes the first symptom that people get. The first symptoms in the first 3 days are the same symptoms that you get with a common cold. Most sore throats are not going to be due to this infection, but if you have sore throat and a very high fever or sore throat and a cough, then it could easily be due to COVID-19. But just a sore throat by itself, I wouldn't worry. There's still a lot of common colds circulating in the community. We still have a fair bit of influenza. Hopefully we're going to see that die off soon. It usually does around this time of year. Kids get strep throat, not uncommonly. So there are a lot of other causes for sore throat.
A couple questions from folks whose family members have asthma. In particular, one person asks how to be proactive about helping children with asthma. She says her son is 5. What can she do to build up his lungs so that if and when he gets better, his outcomes might be better? What have you seen with these types of patients, she's asking?
Well, I will say that first and foremost, I am not a pediatrician. So I am not an expert in children, but generally speaking, I am not aware of any prophylactic measures in people with asthma. Simply making sure that your asthma is treated and having an asthma action plan with your asthma physician or your primary care doctor, and to make sure that you are adhering to all of those prescribed treatments.
Unfortunately, we're seeing very little of this disease in children that young. It's not that they can't get it, but we're seeing very little of it and very little severe disease in children that young, even those who have asthma. A lot of kids have asthma, and we're really not seeing many problems with it in kids under age 15.
We've got a lot of questions, just to switch gears a bit here, about the virus itself and the particles, where it stays viable and for how long. Is it dormant? Can it be picked up later? Do you all have some thoughts about where the science is today? I'll just finish the series of questions here. How long does it stay on clothing, on vegetables, on other sorts of surfaces? Do we have any idea?
Fortunately, most clothing is porous, and it will not survive very long on porous materials. I still recommend that healthcare workers wash their clothes when they get home because it may survive there for a few hours. There's a lot of stuff in the literature about it living on stainless steel for 3 days, cardboard and other surfaces for 24 hours. What we don't know is how infectious it is on surfaces. Infections are spread two ways: by droplet when someone coughs on you or sneezes on you, and that's by far the most common way people are going to get this infection. And the other way is fomites from a surface that you touch, and it's possible to get it that way. But if we're more careful about washing our hands before we touch our face or before we eat, that's the most important thing. I still recommend people wash their fruits and vegetables like they normally would. But I don't think we need to be overly anxious about that, or OCD about doing that, because I'm not sure it will benefit us too much. What do you guys think about that?
I definitely am in agreement with what you said, Dr. Springer. I think the other things we have to think about when you're thinking about surfaces, and not getting too technical, but things stay on surfaces differently in a room that doesn't have great air versus when you're outside and you have breezes and the air blowing. And so it's very difficult to I know people are wanting specific numbers and hours and so forth, but it's very difficult because of the environment we live in and how the air pressure changes in different areas. And so I think really the biggest take home, just as Dr. Springer says, is we know that you can get it from contact. So you touch something that may have an infectious particle on it, and the main way to get this virus is through nose and mouth and potentially eyes. And so that is why the foundation of infection prevention here is wash your hands, wash your hands, wash your hands. If you touch something and it's infectious, but you wash your hands with soap and water afterwards or antimicrobial hand gel, the likelihood of you giving it to yourself is really, really low. It's really easy if you follow that mode of thinking.
Should we minimize our trips to the grocery store, or as much as possible, or other places where staying 6 feet apart or avoiding touching surfaces that other folks have touched is practically difficult?
Yes.
I think so. Yes, absolutely.
Just a couple more questions along these lines. Someone says, I don't have disinfectant. Will wiping surfaces down with soapy water work?
Yes, it will. Soap and water is just as good as disinfectants. I don't think disinfectants work any better. Any kind of soap that makes suds creates a saponification that will kill the virus.
And the reason for that is the virus actually has what's called a lipid layer, so a fat layer. And if you break down that fat, you kill the virus. And that's why soap does that. And that's why soap is effective.
Just along the same line, someone said, go ahead, sorry.
I just also wanted to add that, while we're talking a lot about hand washing, a lot of people that I see don't actually wash their hands properly, and having good hand washing technique is essential. Just putting some soap in the palm of your hands and rubbing them together and quick in and out under the running water, that's not gonna cut it. In order to make sure that you wash your hands properly, there are very good resources on the CDC website and also the WHO website talking about making sure that you lather up, scrub all surfaces of your hands, making sure that you get each of your fingers, and then doing this under running water for 20 seconds. And that hand washing technique is also vitally important.
I'll ask our team perhaps to provide links, although people can probably find these on their own, to the sites that Dr. Krishman's suggesting, the World Health Organization and the Centers for Disease Control, the CDC. Along the same lines, I'm just going to stick with this for a bit here. Someone says, I live alone, and while I'm practicing good cleaning habits, presumably also spending 20 seconds there, how often should I be washing my hands and cleaning sinks and kitchens, bathrooms, etc.? I don't want to be fanatical about this.
I think the answer to that is, so if you live alone and you're not going out frequently, you're kind of adhering to the guidelines, your risk of having it is very low, and so you don't really need to protect yourself against yourself. Obviously, if you're having people coming into your home from outside, or if you are going out frequently and in contact with people, then that changes things, because there is the potential that you could bring that into your home. And so I think if you're on your own and you're adhering to those guidelines, really just, routine hand hygiene. So high touch surfaces, when you would usually wash your hands. So obviously going to the bathroom, if you're bringing in, food from the grocery, or you're having it delivered and you're touching something, after you've put that food away, wash your hands. But certainly, like Dr. Springer and Dr. Cushman had said, really just your usual daily routine with hand hygiene, and then just with the addition of if you're bringing maybe something in from the outside. But if you're living on your own and don't have lots of people coming in and out, I think you're really at low risk.
I'll take a station break for a second here. We don't have any advertisers, but I noticed the team very quickly put up the resources that Dr. Cushman was suggesting at the WHO and CDC. So I want to thank my able staff who are all working from home to make this possible. If you're joining us, we're having a conversation with a group of infectious disease specialists, Dr. Ellenbogen, Dr. Cushman, Dr. Springer. Again, I'm thankful to you, and we're about halfway through our conversation. This is not the first nor the last of the virtual town halls that we'll be holding. We'll be doing this every Friday at noon through Facebook at Romanoff 2020 and on Zoom, and you can find the details at andrewromanoff.com. I want to come to a couple of other questions about containment. Again, this may be beyond the scope of our conversation, so we'll get folks from state agencies on subsequent town halls, but folks are asking, what are we doing in Colorado to reach containment? What's the goal for that? Have we begun contact tracing and surveillance?
That's a good question, and I wish we all knew the exact answer to that. Unfortunately, we are still seeing the number of cases rise in Colorado, and they're rising exponentially at this point, which is why we now have the stay-at-home order. The stay-at-home order will definitely help with that. We hope that it'll help within the next few weeks. My guess is it'll take a few more weeks before we really know where we're headed. But as soon as we see that curve flatten, so to speak, we'll likely be able to get back to more normal lives. In South Korea and in China, it took 8 weeks to get there. We're not those countries. We have a little bit different epidemiologic curve, but that might give us a bit of a picture of what we're looking at.
And in terms of what is being done, we are all in touch with, contacts at the state and public health departments, and they will be better equipped to answer those questions. But we do know that they are doing contact tracing. We know that they are working very hard to try to manage cases that are people who are known to be positive, but they will likely have much better details than we would have.
Dr. Springer mentioned the experience of other countries, and again, I know we're not here to talk international or even national policy, but do you take inspiration from the flattening of the curve, or have you seen such a flattening in other places around the world?
I mean, I think that sort of goes with the natural progression of infections. At some point, they will flatten out. And so I think it's, it sort of, I think would say makes us cautiously optimistic. I think we know that at some point, the surge will, or we will overcome a surge and it will flatten out. I think the issue though is the timeline of that. And I think that we just need to be careful. It's good to be hopeful, but I think we also need to be realistic. And we know that in other viruses, we can model how other viruses behaved. This has some similarities to other viruses such as the MERS virus and the SARS, but it has a lot of differences as well. And so while we know that it will get better, we are not really in a position to say exactly when. And we know that it's going to take several weeks to maybe months, and that's not an unreasonable proposition. We hope that it will take less time, and we hope that with social distancing And with these restrictions, those are all there to mitigate that and to help flatten the curve faster. But we also are aware that if we don't take these restrictions seriously, so we don't social distance, we don't wash our hands like we should, that this will likely prolong this event. And so I would say personally that I'm optimistic that we will flatten the curve, but the speed at which we do that will depend upon how we as a community and as a population adhere to the guidelines.
Can I ask, just to continue this line of projection, what does your read of the evidence tell you about the likelihood that warmer weather will bend the curve or slow the spread? And second, whether the return of colder weather may prompt another outbreak or an acceleration?
Well, I can tell you that we know that viruses don't tend to like warm, humid conditions. They seem to prefer and live longer in colder, dry conditions. So we know that with other viruses. So if that's the case with this particular virus, then it would suggest that as the weather gets warmer and more humid, things would improve. We know that in more tropical climates right now, and in the southern hemisphere, which is just coming out of their summer, they don't have as many cases as countries in the northern hemisphere, which also goes along with that trend. But again, I don't know that the data is there to support that with this virus just yet. If the other doctors can chime in, that would be good too.
Well, I was just going to add that also in summer, people are less likely to be inside. They're more likely to be outside. And with school being out of session, even though kids don't get very sick with this, they probably play some role in being vectors. So that's another reason why we often see viruses kind of drop down during the summer months and come back in the fall or winter. I do suspect we'll see that continue to happen with this virus until we have either a cure or a vaccine that everyone can get, or herd immunity, which will take a long time to develop. We will likely see it come and go. The goal of this social distancing is not to get rid of the virus. I mean, we'd love to do that, but that's not what we're doing with social distancing and the stay-at-home order. The goal right now is just to not have so many cases that our healthcare system can't deal with it. We're reaching a level where we could run out of ventilators, we could run out of critical care rooms, we could run out of the protective equipment that the hospital staff needs to use to be able to care for patients. And so that is the main goal right now, is just to be able to care for all the patients who are critically ill with this so that we can save lives.
If we take your advice and if we heed the guidance of public health experts around the country, what's your projection about the percentage of the population likely to contract COVID-19, and what share of those who do are likely to be either asymptomatic or have only mild symptoms? Do you have any read of that evidence now or projection to share?
That's a difficult question to answer because we aren't testing everyone. And so this may be a partial answer, but if you don't test everyone, you don't know who is positive and asymptomatic and who is not. And so I don't think that there's a good answer for that. I think what doctors...
Oh, I was going to say epidemiologists have studied this, and based on how the infection is spread and how it can infect almost anyone, they estimate that eventually 50% of the population will be infected. And that will happen over some period of time, depending on a lot of factors, including this stay at home. That will slow the curve, so to speak. But eventually, probably 50% will have had the infection. I don't know what percentage are asymptomatic, and we don't have the data to show that yet.
Let me just follow this train a bit here and do justice to one question in its entirety. One of our participants is asking she says, if I understand correctly, the stay-at-home order is mainly to keep the spread of the virus down and to keep from overwhelming our medical facilities and also having a shortage of ventilators and protective equipment for health workers. In other words, she says, buying time. My question is, when these orders are lifted and people start going back to business as usual, won't the risk of getting COVID-19 recur? She says, I'm high risk, I'm elderly, I have other underlying conditions. So I feel like until there's a vaccine or successful treatment, I will have to stay isolated or take the chance of being exposed. Is that correct?
I think there is some truth to that. I think we will continue to see it spread for a long time. And I, like I said, the goal is really to not overwhelm our ICU systems. People are still going to be at risk. We obviously can't have a stay-at-home order forever. Our economy is suffering from that as well. And we as infectious disease doctors don't make the policy decisions like that. But we all do know that we're likely going to see the number of cases decline with this order, and we're likely going to see them rise again when people go back to their normal lives. We just hope that we can continue to take care of everyone.
It's hard to imagine, even whether you're elderly or not, staying at home for 12 to 18 months under these circumstances. Is that a prospect for some folks, or a good practice?
I would say certainly if you are a high-risk individual who is elderly and you have multiple medical comorbidities, trying to do your best to minimize unnecessary travel, minimize unnecessary trips out of your home, staying away from people who are sick is advisable, because as Dr. Springer says, you know, she's right. Based on what we know from other viruses, you know, it's likely that as social distancing really starts to take effect, we will see the number of cases drop. But, you know, I think as someone who did have to come to work today, and who's someone who looked over the stay-at-home order when it came out, there are still a very large number of people who are out and about doing their daily activities. There is a very large number of people who are considered critical to the infrastructure of the functioning of our community and our country. So I think it is important to realize that, you know, this alone isn't going to make it go away, and we're going to need to remain vigilant.
Let me ask you about someone who doesn't have the essential activity that would require them to be at work. He says, I've been exposed to someone with COVID-19, subsequently had mild symptoms, sick but no fever, no major lung issues, haven't been tested, so can't confirm that he has the virus. He says, but he's read differing information on when he would be clear. His work says not until 14 days after no longer showing any symptoms. How can he confirm when it's safe even to go back to the grocery store or back to work?
The CDC recently updated their guidelines of when people can return to work. And what those guidelines say are, if it's been 7 days since the start of your symptoms and you're improving, and it's been 72 hours since you had a fever, you can return to work. And that's because we know those people are very, very unlikely to still be infectious. For healthcare workers, it's a little more stringent in that it needs to be 10 days from the start of your symptoms. So he can consult that, and that might help him decide when to go back to work.
And I would also add, I would also add that many companies have a division called occupational health, and a lot of company, and I also want to emphasize to the public that each hospital system, each company they take their guidance from the CDC, from the Colorado Department of Public Health, but every individual company, hospital system, corporation will probably be coming up with their own policies and procedures. And usually a lot of that is coordinated with your company's occupational health department, and they will be an excellent resource for you as well.
Have you all followed the tests that are underway in Telluride and other parts of San Miguel County for antibodies?
I'm aware of it.
Somewhat, yes.
Any thoughts on that, or do we know anything yet?
They have not been subjected to a clinical trial, and we don't, first of all, we don't know how many people who've made antibodies will have a positive test for those. We don't know how protective the antibody is. If a measuring an IgG means you're protected. It probably does, but we don't know that for sure. I hope that through the studies they're doing in those counties, we will learn more, and I think we will in time, but my guess is it'll take 6 months or so of collecting data to know how useful that test is.
There are a lot of concerns, and again, I'm going to try to plow through as many questions as I can in the 10 minutes we have left. I appreciate your persistence here. Are we going to become the next New York or Seattle? Are we doing enough in Colorado to avoid that fate?
So this is Dr. Ellenbogen. I mean, I think that's difficult to say. Hopefully we, you know, we're learning from our colleagues in those states. We are sharing a lot of information and communication with each other. A lot of those states that are dealing with huge surges are sharing their protocols, sharing what they've been doing with the rest of the country who perhaps are not at that point yet. And so I think what I would say is that we are, right now in Colorado, we are looking to those states and thinking that we may be there and trying to do everything we can so that if we do get to that point, that we are prepared. At this point, we are not at where New York is, but I don't think that any of us would be complacent and think that that could not happen to us. And so we are preparing as if we are expecting it to happen to us, so that if it does, that we will be ready.
Another question from the Western Slope, in this case from Mount Crested Butte. I live in one of the ski resorts, does a lot of summer tourist business. We're concerned about bringing in a lot of new people from all over the country because we don't want to start another round of the illness. I know you don't have a magic wand, but what might we expect from an influx of tourists? What should we be doing to protect ourselves?
I would say that, you know, there are reports to that question. There are reports from China that they are starting to experience a new quote unquote second wave of imported cases from travelers and people who are coming into the country. So I understand that's a very legitimate concern that, and a lot of other public health professionals are saying that, you know, while the areas of the country that are being most affected right now are densely populated cities, that eventually as things start to calm down and as people begin to move about again, that is a risk of the virus getting into some of the smaller communities throughout the country, especially parts of our country that are highly dependent on tourism for their livelihood. And my recommendation would be to continue with the best health practices that are currently being recommended by the Public Health Department and the CDC. Washing your hands is critical, and trying to keep yourself healthy.
I'd like to add one piece of public health information that we haven't touched on yet, and that is the importance of staying home when you're sick. And I hope the contagiousness of this virus and the fact that our loved ones are suffering and that we're seeing people die of this virus will remind us that we need to stay home when we're sick. I feel like our public has become somewhat complacent about the flu because we see it circulate every year and we see a certain number of deaths and it just seems like the same old news. But this is new, and I'm hoping it reminds us to just stay home when we're sick. That's going to be the best way to protect the public. So even if you're traveling to the mountains, if you become sick, stay in, because it's very contagious, and it's most contagious when an ill person coughs within 6 feet of another person. So if an ill person just stays at home, they're not going to spread it as well.
Let me ask just about the flip side. Someone here is asking, there are folks afraid to go to the hospital with other conditions now. What can be done in those cases?
I would say that if you need medical care, please come to the hospital. We are doing our best to protect not only our patients and ourselves, our patients that several hospitals have separate areas where they are keeping people that are concerned for having COVID and trying to cohort them, if you would. But if you think you are otherwise unwell and you think you need medical attention, please come. Waiting longer can oftentimes make things worse.
And I think we're doing a very good job of containing it. To my knowledge, we have not had a hospital spread case in the state of Colorado. And I know it hasn't happened in the hospitals where I work. And we've seen several cases of COVID-19, but the staff know how to wash their hands and prevent spreading it from one person to another. It's not going to survive in an elevator. Like if you get in an elevator that a COVID-19 patient had been in earlier in the day, you're not going to catch it like that. So I think being at the hospital is actually very safe, and people need to be in the hospital if they need to be there.
Let me just parse this point though. Sorry, just for one moment, stay home if you're sick, but go to the hospital if you need medical care. How do you know which is which?
Well, I think that if I can make a point to this, so one of the things I think that maybe being, I don't know if the word ignored is correct, but people who have chronic medical conditions, the people who are most at risk for getting very sick are people who are immunocompromised, so people who have cancer or other immunocompromising conditions such as poorly controlled HIV or AIDS, who are on maybe some medications that are immune modulating, so decrease your immune function, people who have kidney disease, underlying lung disease, morbid obesity, and people who have diabetes, and any of these chronic conditions that are not well controlled, you are more at risk for getting sicker if you get this virus. And so what I think is really important to emphasize is if you are a diabetic that's not well controlled, or you do have hypertension that is not well controlled, now is the time really to really focus on controlling your underlying chronic diseases. Because if you take your medications, if you're adhering to a good diet that can keep your blood sugars under control, you are also, aside from avoiding people and washing your hands, by controlling your chronic diseases, that goes a long way to help prevent you from getting sicker if you get this disease. However, if you are sick from your chronic disease to a point where this is something where it's very different from the norm, you should go to the hospital or call your physician and tell them your symptoms, and they may direct you to the hospital. But don't avoid being in the hospital if you are getting sick from any of your other conditions. That would not be good, because then you would be compromising your other conditions in an effort to prevent from getting this one, and that could be very, very detrimental.
Some warning signs. Oh, I was going to add with some warning signs with the virus in particular. As we mentioned, most people will be sick at home and recover at home. But warning signs, if you cannot eat or drink, then you're not taking care of yourself. You're not able to take care of yourself. And if you feel like you cannot get oxygen in, those are reasons to go emergently to the emergency department.
And as Dr. Ellenbogen said, your regular physician is there to help you. If you have a question and you're not sure, if your symptoms are severe enough to merit going to the hospital, your regular physician will be able to help you decide.
Just a couple minutes left and a few quick questions. What are the risks of laundering or drying clothing at community or apartment laundry facilities?
I think there's very little risk to that. Laundering will kill the virus. The soap in the laundry will kill the virus, and the heat of the laundry will kill the virus. So I think there's very low risk. Technically, touching the machines that sick people have touched could potentially spread it through fomites, and you prevent that by washing your hands.
A group of us, one participant says, are making masks for the police and fire department. Is that a good idea?
There's been a lot of news about that. First of all, it's great that there's been such an effort. Different places will have different protocols. In the hospital environment, we are not recommending that. Some of these homemade masks, if you're doing it to try and prevent the droplet particles from getting into the mouth or nose, the material that those masks are made from may not do that, and actually may cause more discomfort and allow for more fidgeting to try and get that mask to fit a certain way. And so it probably isn't going to have too much benefit, frankly. So I would say no.
One viewer says she's heard that people are dumping pets at shelters for fear of getting sick from contact with their dogs or cats. What thoughts do you have regarding any risk posed by pets or ways to reduce the risk if there is any?
There is no data to support that. We know that there have been a couple of reports that pets have tested positive. Very, very, very few reports about that, but there's absolutely no data at this point that pets can transmit the infection. And so there are no recommendations for people to be giving up their pets. There are no recommendations for people not to be adopting pets. There is nothing to support that there is pet transmission to you. However, if you are sick, and this really kind of goes in general, you should probably avoid cuddling with your pet and excessive petting of your pet. But in terms of, and wash your hands, obviously, but in terms of pet to person transmission, there is no data to support that.
I say keep your pets.
Yes, keep your pets.
Do what you would normally do. Love your pet, cuddle them, then wash your hands.
Well, that is a happier note to end on. And I want to thank our panelists and thank all the folks who have joined us. Again, we'll be holding these town hall meetings on Fridays at noon. I recognize we didn't have time to do justice to all the questions we had coming in. We're going to be joined in the weeks ahead by other public health experts, by representatives from hospitals to discuss some of the policy implications that might emerge both from this pandemic and how to end it and how to prevent the next crisis or at least mitigate its effects. Again, to Dr. Ellenbogen, to Dr. Cushman, to Dr. Springer, I want to say thank you all very much, not just for spending an hour here answering our questions, but for what you do every day to save lives. I appreciate it, and I know all of us in Colorado do as well. Thank you all very much, and hope you will join us again at andrewromanoff.com.
Thank you, Andrew.
Thank you, Andrew. Pleasure to be here.
Thanks so much.
Thank you.
Be well.
And you.